Welcome to Wimpole Street Dental Clinic. My name is Chris Schimel and thank you very much for visiting our webpage. And the following video shows one of my favorite topics where we can really help patients in dire need of a new tooth. It is immediate implants. Immediate implants means that we can remove the tooth, place the implant and place a temporary on the same day we have removed the tooth. So I really hope that you enjoy the video and thank you very much for your time.
You can see here the initial situation and you can guess the problem. The upper left front tooth is so severely damaged that we have to take it out. You can see here after the crown removal there's not much tooth substance left, so it's almost impossible to place a crown on that tooth, which will last you a long time. Additionally, this tooth had an infection at the very tip of its root, so this tooth needed to be taken out. Of course, in the old days we took out the tooth, waited 3 months, placed the implant, waited 3 months and then placed the crown. So you had an intermediary period of approximately 7 to 8 months where you didn't have the proper tooth. Nowadays we can do that differently. We do all of that in one day. That means we take out the tooth like you've just seen. And this is the empty place where the tooth has been. It is very important that you are very careful when you remove the tooth. And directly into that hole, you can place the implant. Before that, of course, you have to remove all the inflammation and all the inflammatory tissue, indicated here with a small yellow arrow. When you've done that, like I said, you can immediately place the implant, seen here. You have to be very careful that you place it in the correct position. And this surgery normally does not take longer than 20 to 30 minutes, but the precision is very important. You can see here the implant placed in the correct position, indicated by the yellow arrow. You can see a small soft tissue graft, indicated by the blue arrow. This soft tissue graft gives you a little more thickness and a little bit more protection in the face of resorption, of bone resorption. And then you can see here the temporary solution on the day of the surgery. On the top left you see the stitch which holds the palatal soft tissue graft, the free gingival graft, how it is exactly called. The situation now looks a little bit severe, but approximately after 2 weeks it will be fine. You have to wear the temporary on the implant for approximately 3 months until we know that the implant is safe and sound and properly integrated into the bone. And after 3 months you take an impression and 2 weeks later you have the final crown. You can see here, this is the soft tissue, absolutely in perfect shape. And if you take an X-ray, you can see the implant sufficiently grown into the bone. The very white part indicated by the blue arrow is the implant abutment, and the crown indicated here by the green arrow is cemented onto the abutment. So again, yellow arrow implant, blue arrow abutment, green arrow the final cemented crown. Thank you very much for your kind attention.